This is the primary area of my practice now, and it's one that I really have a personal invested interest in, just being that I myself like to compete in different fitness competitions and things like that. Now, I put this together because both as a rehab physician and small business owner, I know what the standard advice is. Get your 8 hours of sleep, eat 150 grams of protein, meditate, exercise, sauna, journal, get 10,000 steps, turn off your phone 2 hours before bed, don't eat within 3 hours before bed, read, challenge your brain. I could make this list go on forever. As well as the same feeling of, yeah, that's impossible. So which 3 or 4 things am I actually going to be able to do here? If this is the mental math that you are forced to do in order to manage your team as well as your fitness goals, keep watching because you will find some nuggets in here just for you. That is nuggets in here for you to discuss with your own medical team prior to initiating on your own, because this is not medical advice. As of right now, we're probably not working together, so I don't have any way to personalize this to your unique medical history. And so this is for educational purposes only. Don't try anything in here without your own physician's oversight and approval for your own health situation. All right, so let me see if I can describe your situation here. You're successful at what you do, and you got there with consistency, strategic thinking, and like me, you probably wonder what combination of supplements and biohacking innovations can help you outsmart biology. By now, you've probably invested in the proper gear, you've studied the proper form, maybe even have a trainer, and you at least get the whole basics of what progressive overload or the general concept of what that is. We're all competing with ourselves first, trying to be better than yesterday version of us. But you also can't help compare your progress to a gym, office, church, gaming buddy. And somehow you're the one racking up injuries while they're able to keep unracking the weights. Here's the first bit of tough love. Don't worry, this is the first and last time. The same things that make you successful, like sacrifice, determination, unwavering focus, and attention to detail, can also wreck your recovery. You'll be sacrificing sleep and rest days. You're going to be determined to go for at least that extra rep or set despite not feeling quite right. You're going to focus and scrutinize your weak areas, either leading to overtraining of them or elevated fight or flight nervous system activity, that sympathetic tone, which brings along a lot of stress hormones that can affect your recovery and performance. And that attention to detail, all the details, too many details, that again makes it really hard to know what's actually meaningful, not just sort of significant. Now, that same attention to detail may occupy the time you would love to otherwise spend on staying current on the evolving evidence. RICE after injuries, rest, ice, compression, elevation, not unless you want to drag out your recovery longer. Immobility is one of the worst things you can do for a strain or a sprain. Also, put down the ibuprofen and the ice baths after an injury for the exact same reason. So decision fatigue, this goes back to when you push through versus when you end an exercise. If your workday is spent analyzing and overanalyzing the risk in complex scenarios, that cognitive fatigue is going to spill over into your third set at the gym when you're hitting your 5th rep to failure and make it really hard to know when to stop and when to keep going. Sleep debt. This is the one that always gets me. I jokingly regard sleeping well as the top superpower in adulthood, which is why it's always my top priority with my patients. In my case, it was actually a bad night's sleep before a powerlifting competition that did me in. In the 5th hour of the competition and my second set of deadlifts, I was lifting 515 pounds off the ground and I tore my hamstring in 3 places at once. So the most obvious reasons for the injury risk from poor sleep and stress related to hormones, of course, is that decreased growth hormone and testosterone will both impair your recovery. And then when your cortisol, that main stress hormone, is elevated both acutely and chronically, you're going to have weak tendons and muscles, and they're just prone to pulls, strains, tears, all that kind of stuff. The less obvious reason why sleep can actually increase your injury risk is that it's going to augment the other risk factors here. As an example, that propensity for decision fatigue, you're going to impair your neuromuscular control. So all those little things that may not be the biggest deal, when you're tired, it's just going to be a much bigger deal, of course. So a lot of these tips here are going to be on ways to do your best despite these sorts of challenges, because if you could sleep more, you'd probably be doing it already. This is going to depend on whatever ails you here. But often you're going to use collagen and vitamin C because those are great for rehabbing tendons, especially when you take a little micro recovery window to practice some isometric holds. That will put minor stress on the tendon, and that tells your body where to send those collagen peptides with the vitamin C to help the enzyme cross-link those new collagen fibers. Magnesium glycinate is great for muscle health, both directly and indirectly for its benefits in sleep over the other magnesium types. Omega-3s, this one's really important based on the timing here. So you don't want it right after workout because it's quite anti-inflammatory. However, when separated enough from your workout, it actually has some growth promoting benefits here and the anti-inflammatory effects will not reduce your recovery from the exercise. Creatine is important for so many reasons here, both for cognitive and mood benefits, especially when you're stressed and sleep deprived, but also, of course, for muscle health. The water weight concerns are actually backwards because you want that water weight. You want that hydrated muscle because it's going to cramp less. It's going to be a lot healthier. It's going to contract better. So that's why creatine is my first recommendation to every person on this planet. The prior concerns about kidney damage were totally unfounded. It's just an artifact of the way that we measure kidney function, so do not worry about that. Doses are usually 5 grams to start, 10 grams, 15 grams these days are what's popping up in the research. Very beneficial stuff, and it's cheap and ubiquitous, not a problem. Okay, sleep tips. We've all heard the sleep tips. Some of them are easier to do consistently. You want to lower that room temperature nice and low. Basically, you want to be cold but not shivering. You don't want to be uncomfortable, but you want to be able to get your body temperature down while you're sleeping because that improves your deep sleep in particular. You want your room to be dark as you can get it and tolerate it. No blue lights in the corner, nothing like that can actually interfere with your sleep. You want consistent wake times. So you may have to sacrifice one night's quantity of sleep to preserve the subsequent night's quantities here. So if you're going to bed late one night, do not sleep in. You want to make sure you're consistent with that one. That's actually more important. My favorite thing to do is swap out Ambiens of the world for some more effective and actually old school medications with fewer long-term risks and better sleep quality. On top of that, there's some new peptides that actually improve your growth hormone release during sleep. And by doing that, it actually improves your deep sleep quality as well. So I will kind of put together little cocktails here based on my patient's different concerns. Is there nerve pain? Is there musculoskeletal pain? Are they more of a REM sleep problem? Do they have more of a deep sleep problem? And you can design the different supports based on these things so you don't have any one major sedating medication on board. So recovery windows. The whole idea here is to bring down that fight or flight tone, that sympathetic drive, and allow your body to recover in between stressful situations. So you can enhance this with red light therapy, those isometric holds I mentioned before. So essentially we'll just engage a tendon very lightly, but enough to feel it, and that can help prepare you for a later workout. Deep breathing exercises are a great way to clear your head, mindfulness, meditation, things like that. Now, the training itself. In this case, my number 1 rule is be consistent. My number 2 rule is don't get hurt, because if you break number 2, you can't do number 1. So if something doesn't feel right, do not push through. I went to the deadlift portion of the competition already feeling a little bit off. I even said, if I tear it, oh well, this is my last competition. Because I wasn't preparing to do anything after that. That was my 3rd competition in a series, so I knew what was coming, and I was ready to make that sacrifice. But if I were in a non-competition setting, I absolutely would have just walked away from the weights because it's not worth risking that kind of injury. Had that been any other workout, I would have hung up that singlet and hit the showers instead. All right, so we're going to go through a simple concept for exercise intensity planning based on the stress response perceived recovery level. But we'll take that in a second. First, warm-ups. This is a place where you can actually save some time now. Because what we used to do, the 10 minutes on the treadmill, random stretching, all that stuff, made you feel like you were doing something, but in reality, all you need to do is a light version of whatever you're about to do. So as an example, and these are not very precise numbers here, I just use a rough guide of my 1 rep max and then reduce the weight from there. So if I'm going to be doing a 315-pound bench, I'm going to start with 135 pounds, do that 6 times just to get everything moving, make sure it feels right. I'm going to do it again for about 10 reps. In that case, it's going to be a nice working warm-up set there. I should feel a little bit of activity, but after taking a 2-minute rest, I should be back to full strength there. Then 225, I'm going to do that for a good 5 or 6 reps. At that point, I should feel pretty ready to go. And you only need to do this for the first couple exercises of a certain muscle group. So if you're doing upper body day, you're going to do it for your first chest exercise, your first shoulders, and your first back. Subsequent ones, you can just do your normal kind of pyramid routine or whatever, going to escalate that way. So looking at the yellow and red days here, I deload by dropping the weight. Other folks may do it by reducing the volume because technically that counts as well. The reason why I pick the weight though is you rarely get injured by doing that 4th set of something you already did safely. It's probably going to be when you increase that weight just by 10%. That may be the straw that breaks the camel's back or the hamstring. So for those red light days, active recovery is dependent on so many different factors here that's very personal. For some, it might be a light jog, a long walk, 20 minutes of isometrics in a sauna, near infrared light, wherever, or you just drop the weight 50% and reduce the volume 50% or so, and just move some weight around. Get the blood flowing. That's enough to feel like you did something. You can clear your head, but you're not going to risk that injury, and you're going to maintain your strength moving forward. So you can tell if you're reaching that kind of overtrained state or just need that red light day based on your resting heart rate. When that goes up, that's a sign that your sympathetic nervous system is a little overactive today, so maybe not push it too much. You can use your prior night's heart rate variability as a measure of how restorative your sleep was the night before. Sleep scores kind of do a similar thing there. Or if you've been doing this long enough, you can just use your gut and trust that one because it's usually pretty close. Number 1 rule, be consistent. Number 2, don't get hurt. All right. So this could be a whole hour-long discussion on its own just because it is so exciting and the research is so cool in some of these areas. No pun intended with that cold therapy. But this is just an example of some of the most accessible cutting-edge options here in terms of where the research is going. So PRP, it's got mixed efficacy in the research. It really depends on for what injury or situation you're using this. But when it comes to tendon issues, plantar fasciitis, other ones, it can be really effective and actually safer than steroids in most cases. Just as another example, I use nitroglycerin paste, the same stuff that you use for cardiac issues. If you apply it on a superficial tendon, that actually is kind of a poor man's PRP because of the platelet activity that it induces. Other aspects in here could be dry needling, massage. That's not very cutting edge, but what works here. Red light therapy. So this is another one of those areas that is all over the place when it comes to the research, but the mechanistic data suggests that there's actually some plausibility here when it comes to muscle, tendon, ligament, brain health, etc. When you're using infrared or near infrared light, there may be some direct benefits in using it right before or right after exercise. Right before, it gets the blood flowing, gets the nutrients to those muscles. Right afterwards, there may be some effect kind of mediated through that acute inflammation. You want inflammation after exercise. That is the theme of this whole conversation here. And on top of that, there might be some unique aspect of the heat itself in terms of how that's going to activate special proteins that are going to also help those muscles build and recover and everything like that. Now, cold therapy, exact opposite here. You want that as far removed from exercise as possible unless you have a certain situation. And that's going to be if you are having a heavy lift and you got something heavy coming after that too. So say you're doing a double header or something in some sport. Cold will help you to have reduced pain and inflammation in that moment, so you're less likely to have an injury in that second bout, but you'll absolutely reduce the benefit you get from that first exercise if you immediately squash that inflammation. All right, so testosterone therapy. This is one where the research is becoming clearer and clearer in terms of the benefits and the safety, as well as what really is not a good idea that we used to think was the best idea here. There's going to be a separate talk on this one too, just because this is a really nuanced topic. But generally, SARMs, those selective androgen receptor modulators that had such promise when they first came out, you actually end up missing out on the benefits of the estrogen, and you can essentially get worse bang for your buck on the androgen side anyway. So you're going to have less benefit and you have more drawbacks actually. Similarly, in clomiphene, that was another one of those great ideas until we really thought about it kinds of things, because this one only blocks estrogen receptors. And if you block those daily, you're going to increase your risk for injury, and you're not going to feel very good doing it either. You have some menopause type symptoms sometimes. Both of those go back to the same thing. Men need estrogen. So estrogen blockers, just given arbitrarily, it's a bad idea. You're going to have worse outcomes, injury risk, poor sleep, all that stuff. Then your libido is going to go down too. So I'm just putting these here as a here's what's on the horizon kind of thing. Like the last slide, this is such a small glimpse at the potentials here, but these are two different examples that can be very illustrative of the kind of mindset going into this stuff here for the informed practitioner. Now, ectosterone, this is something that's emerging right now, but it's a really cool concept. So going back to that estrogen actually, we now know that there's certain estrogen receptors that are particularly important to be working on here. So ectosterone works on the one that doesn't give you the feminizing effects, but instead is great for anti-inflammatory effects in the brain. So great if you're going to have nights of bad sleep, theoretically, as well as works on the tendons and muscles for the estrogen benefits there too. cardiovascular system as well. So the beauty of this, though, is that it doesn't cause the same secondary estrogen effects that you don't want to have, because it doesn't work on the estrogen alpha receptor. And that's the one that is going to cause your own hormonal regulation to go off the rails, as well as breast tissue, all that kind of stuff. So this is one of those neat supplements, not well studied yet, but there was one study that everyone points to, which is the reason why it's actually banned by the World Anti-Doping Association for professional competitions, because it showed a pretty clear benefit in strength, in bench press in particular, and muscle mass gains in 10 weeks. So it can be quite effective. You can get it over the counter, but the research just isn't there yet for a full understanding of risks and benefits, though knowing how that receptor works seems like it's probably pretty darn safe. Peptides. So this is the Wild West as well. But there's a handful of these that I use in my own practice because they're reasonably well studied, and we know where our blind spots could be. So BP157 is another one of those where the hype is driven by anecdotes and not hard data, but those stories are really impressive. That's why they call it the Wolverine peptide. This is the one that folks are getting and injecting when they have different rotator cuff tears or meniscus tears or whatever it might be, just because BPC stands for body protecting compound, and it is derived from our own GI tracts here and can stimulate recovery and reduce inflammation, all that kind of cool stuff. But we don't know the negatives, and I'd like to know what those are so we can keep that in check and keep that in mind. But no studies have identified any yet, and that makes me leery. Now, there are other ones that are pretty well studied, and those are going to be some of your morlins. Sermorelin, tesamorelin, ipamorelin, and then some of the CJC is related to that too. When it comes to morlins, I love these before bed because those are the ones that increase your growth hormone. So we have a short-acting version of this, sermorelin, ipamorelin, and you take it before bed, you're going to get that nice peak of growth hormone when you're sleeping, when you want it, and then it's going to fade off by the end of the night there. So you're going to have the benefits of that growth hormone when it matters in the normal physiology, the normal circadian rhythm, but you're not going to violate that by then stimulating growth hormone all the next day, and et cetera, which is where the issues likely come in here. You want to make sure you're obeying physiology whenever possible, or at least respecting how that works, and that's where you may tend to see fewer side effects. That being said, they've not been well studied in healthy adult populations. Some of these have been approved by the FDA for treating clinically identified low growth hormone. So in the cases of healthy individuals who are just not sleeping well, I haven't seen any large scale data on those, but the other ones don't show the similar growth hormone negatives like high blood sugars and cancer risk and all that kind of stuff. So that makes me feel more comfortable. But again, this is one of the best cases of talk to your own doctor about this stuff too before you start looking around on the internet for it. And now GLP-1 medications, liraglutide, semaglutide, tirzepatide, all the newer ones. These have some great benefits in terms of metabolic health without the same side effects that some of the medications and supplements like metformin and berberine might have. Now, those are two that folks will often take to improve blood sugar without really needing to go on the stronger stuff. But in actuality, berberine and metformin have both been identified to actually reduce your benefits of exercise because of some of the anti-inflammatory effects and the way they work in different parts of our cells. So for that reason, I would much rather take someone who's on low dose of metformin or high dose and move them over to a low dose of semaglutide or tirzepatide. And this way you can get the metabolic benefits, but you're not going to get the negatives there. Implementation. So in this case, there's no reason to sacrifice the whole game just to gain an inch. So I'm going to start with the fundamentals and then see where you can make up the difference. Start with what is well known, your collagens, your creatines, all those sorts of things. Then add in a little bit of extra with the medical oversight and target where the weaknesses are. Is it your sleep? Then find ways to optimize and enhance your sleep restorativeness. Is it going to be your nutrition? Is really hard to get the amount of protein we need. That's where you're going to need different supplements. So good whey protein, egg protein, pea protein, whatever it might be fortified that with certain amino acids that you know are going to be deficient in your kind of diet. That's where I start my kind of designing a plan for somebody kind of process. All right. Overall, when you're looking for somebody in your corner, you just need to find somebody who aligns with your fitness goals and your medical complexity and your tolerance of uncertainty. There's some great health coaches out there, some with actually really impressive Twitter followings and newsletters even, and they can keep you accountable when everything's going swimmingly. But most of us need somebody who knows they'll get the outcomes they expect, regardless of whatever roadblocks your biology is going to put up. So you need someone who's going to be skilled enough and trained enough to overcome medical roadblocks as they pop up so you can keep your progress going. You really need your performance team to be battle tested here because nothing ever goes according to plan.